Hi, Dr. Seth Gerlach here for a patient testimonial today. So this is our good friend, Patty. Say hi, Patty.
Hi.
And so Patty came in with lots of issues, and we've been working with her for a little bit now, and we got some results that we wanted to share with you. So Patty, what were the big things that you came into the office with? So what were the big complaints?
Well, primarily I had a lot of pain from the waist down, especially my hips, my knees, my ankles, and then in the front and back of my legs, so that it restricted so much of what I was able to do before all of this set in.
Gotcha. And I remember also some like GI issues, some gut issues also.
Yes.
Reflux, things like that.
Yes.
Right. For how many years did you have that? Do you remember?
Reflux, probably 3 or 4 years.
Gotcha.
The pain set in several years ago, maybe 3 or 4 years ago. So thought it was back issues and had gone to a couple of different doctors, mainly a pain doctor the last few years.
Gotcha. Right. And then another thing was, I think, energy levels also. Is that right?
Yes.
Gotcha.
I didn't have much energy, and to do 1 or 2 things around the house was very difficult, and we made a big move, and it just about did me in.
Oh gosh, yeah, I remember
it was
that.
so hard. So
I always ask people, like, how did that affect your daily life with the pain, the fatigue, the GI problems? I mean, what did it keep you from doing?
Well, cooking became more of a chore because of standing and trying to do housework, clean one bathroom and I'm done in. I loved to take long hikes and with my husband and ride a bicycle, and those things became impossible. So shopping was no longer fun. I became a hunter rather than a shopper.
Right.
So I go immediately to what I needed to get and leave. So that was also restrictive because I enjoyed browsing and antique shopping, and I could no longer browse.
Yeah, so it changes your whole life.
It does.
Your whole day.
It
really.
does.
Yeah. So one of the things that we did and you did, because a lot of the stuff that you do, what are the stuff that we did that made a difference? Do you remember?
Well, we began with my diet, and I changed completely the way I eat. So now I have a healthier diet, much healthier diet. I've lost weight as a result of that. But we also added some supplements, and that has been very helpful. What's the other thing we did?
So I was going to talk about, we saw a lot of inflammation in the body,
yes,
in the gut.
Did.
We worked on that. Digestion, kind of getting that all back on track. Which, are we on the heartburn medication anymore?
No, I no longer take it.
That's
I
great.
use the supplements instead if I have a flare-up.
That's great. So great. And then just kind of balancing out the gut or things like that too, right?
Yes.
Awesome, amazing. So what are the big results then? What's the big changes you've seen?
Well, I've lost almost 30 pounds.
Nice.
I can have a long active day. I'm careful about what I do, but I have a lot more energy, have a lot more stamina. I can enjoy my life a whole lot better. I sleep better at night because most of the time I don't have the pain that I had before. So those are, let's see, what else? Okay,
She's got a list.
think I have a list.
I think you nailed it.
Did I get them all?
I think you did though. But thank you so much, Patty. You progressed so well, and you've done everything we've asked. We can't ask for a better patient, but we really appreciate you sharing this with everyone too. And I'm so glad that you've seen some of these changes.
Well, it's my pleasure. I'm always glad to come and meet with you, Dr. Seth, because you're always so encouraging. You always have solutions for me. You have given me hope, and you've given me a lot more joy in my life as a result. You treat me as a whole person and not just my symptoms. You're working on getting to the root of the problem, and I just really appreciate that.
Oh, that's great. Thank you so much for the kind words, and that's what we're shooting for every time.
Well, I recommend Core Health to everyone.
Thank you so much. Thank you, Patty. I appreciate it. Thank you.